Pathomechanics, what it is and why it matters. Do you know what happens when you break a bone or sprain a muscle? Your body tries to heal itself, but sometimes it does not do it perfectly. Sometimes, the broken bone or the injured muscle changes the way your body moves and works. This can cause more problems and pain in the future. This is what pathomechanics is about. Pathomechanics is a word that means the changes in the normal movement and function of a body part as the result of an injury or a disease one. It comes from two Greek words, pathos, which means suffering or disease, and mechanikos, which means relating to machines or movement. Pathomechanics can affect any part of your body that has bones, muscles, joints, tendons, ligaments, or cartilage. These are the parts that help you move and support your weight. For example, your spine is made of many bones called vertebrae that are connected by discs and ligaments. Your spine helps you stand up straight and bend in different directions. But if one of your vertebrae is out of place or damaged, it can affect the way your spine moves and works. This can cause pain, stiffness, or numbness in your back or other parts of your body. Causes and examples of pathomechanics. Pathomechanics can be caused by many things, such as 1. Trauma. This means a sudden injury that damages your body, such as a fall, a car accident, or a sports injury. 1. For example, if you break your leg in a car accident, your bone may not heal properly and may change the shape or alignment of your leg. 1. This can affect the way you walk and put more stress on your other leg or your hip. 2. Disease. This means a condition that affects your health, such as arthritis, diabetes, or cancer. 2. For example, if you have arthritis, your joints may become swollen and inflamed. 2. This can make them stiff and painful and limit their range of motion. 2. This can affect the way you move and perform daily activities. 3. Aging. This means the natural changes that happen in your body as you get older, such as losing muscle mass, bone density, or flexibility. 3. For example, if you lose muscle mass in your legs as you age, you may have less strength and balance and more risk of falling. 3. This can affect the way you walk and stand. Some examples of pathomechanics are 1. Flat feet. This means that your feet have low or no arches and tend to roll inward when you walk. 1. This can change the way your feet support your weight and affect the alignment of your ankles, knees, hips, and back. 1. This can cause pain or injury in these areas. 2. Scoliosis. This means that your spine has an abnormal sideways curve. 2. This can change the way your spine supports your body and affect the balance of your shoulders, ribs, pelvis, and head. 2. This can cause pain or breathing problems. 3. Rotator cuff tear. This means that one or more of the tendons that attach your shoulder muscles to your upper arm bone are torn or damaged. 3. This can change the way your shoulder joint moves and works and affect the stability and strength of your arm. 3. This can cause pain or difficulty in raising or reaching with your arm. Diagnosis and treatment of pathomechanics. Pathomechanics can be diagnosed by a doctor or a physical therapist who will examine your body and ask you about your symptoms, medical history, and activities. They may also use tests such as X-rays, MRI scans, ultrasound scans, or blood tests to check for any damage or disease in your bones, muscles, joints, tendons, ligaments, or cartilage. Pathomechanics can be treated by different methods depending on the cause and severity of the problem. Some common methods are 1. Rest. This means avoiding activities that cause pain or stress on the affected body part until it heals or improves. 1. For example, if you have a rotator cuff tear, you may need to rest your shoulder for several weeks and avoid lifting heavy objects. 2. Ice. This means applying cold packs to the affected body part to reduce swelling and inflammation. 2. For example, if you have flat feet, you may need to ice your feet after walking or standing for a long time. 3. Heat. This means applying warm packs to the affected body part to increase blood flow and relax muscles. 3. For example, if you have scoliosis, you may need to heat your back before doing exercises or stretches. 4. Medication. This means taking drugs that can help with pain, inflammation, or infection. 4. For example, if you have arthritis, you may need to take anti-inflammatory drugs or antibiotics. 5. Braces. This means wearing devices that can support or correct the alignment of the affected body part. 5. For example, if you have flat feet, you may need to wear orthotic inserts in your shoes that can raise your arches and prevent your feet from rolling inward. 6. Exercises. This means doing physical activities that can strengthen or stretch the muscles, tendons, ligaments, or cartilage around the affected body part. 6. For example, if you have scoliosis, you may need to do exercises that can improve your posture and flexibility and reduce the curve of your spine. 7. Surgery. This means having an operation that can repair or replace the damaged or diseased body part. 7. For example, if you have a rotator cuff tear that does not heal with other methods, you may need to have surgery to stitch or graft the torn tendon. Here are some scientists who have contributed to the field of pathomechanics and their inventions briefly. 1. Carol Oates. She is a professor of physical therapy at Arcadia University and the editor of the book, Kinesiology, The Mechanics and Pathomechanics of Human Movement. 1. She has conducted research on gait analysis, osteoarthritis, and joint biomechanics. 1. She has also developed a clinical tool for measuring knee joint motion and stability. 2. Alexis A. Wright. She is an associate professor of physical therapy at High Point University and the lead author of a scoping review on the exercises prescribed for patients with femoroacetabular impingement (FI) syndrome. 2. She has investigated the pathomechanics, diagnosis, and treatment of hip disorders, especially FI syndrome. 2. She has also developed a clinical prediction rule for identifying patients with FI syndrome. 3. Chris Hughes. He is a professor of physical therapy at Slippery Rock University and a reviewer of the book, Kinesiology, The Mechanics and Pathomechanics of Human Movement. 3. He has studied the effects of exercise on muscle function, fatigue, and injury prevention. 3. He has also developed a device for measuring muscle stiffness and a method for assessing muscle fatigue. 4. W. Ben Kibler. He is a professor of orthopedic surgery at the University of Kentucky and the lead author of a consensus statement on the disabled throwing shoulder. 4. He has conducted research on shoulder biomechanics, injury prevention, and rehabilitation. 4. He has also developed a classification system for scapular dyskinesis and a clinical method for measuring scapular position. 5. Angela Spontelli-Gisselman. She is an assistant professor of physical therapy at High Point University and the co-author of a scoping review on the exercises prescribed for patients with femoroacetabular impingement (FI) syndrome. 5. She has investigated the effects of hip joint mobilization and exercise on pain and function in patients with FI syndrome. 5. She has also developed a clinical prediction rule for identifying patients with FI syndrome. 6. Thomas W. McPoyle. He is a professor emeritus of physical therapy at Northern Arizona University and a co-author of a review article on the functional anatomy, pathomechanics, and pathophysiology of lateral ankle instability. 6. He has studied the biomechanics and management of foot and ankle disorders, especially chronic ankle instability. 6. He has also developed a device for measuring foot posture and a method for assessing foot mobility.